testimony here after everything I've heard, but it is mine, and I'm really tickled with it.
Fabulous. Let's hear it.
Well, the journey started here at the first of the month when they okayed me for a double knee surgery. So I went in on the 9th, April 9th, and one thing they wanted to know was if the Prodovite would cause or affect my ability to clot at all. So I called Gina, and she called back and said it wouldn't. So I went from 1 capsule to 2 capsules a day. That was on the on the 2nd, April 2nd. April 9th, I had both knees replaced. And to make this quick, 12 days later, on April 21st, I gave my walker back to the therapist, who was in a state of shock. On the last day, my home therapy was the 25th, last Friday. They gave me a little graduation test where they put a chair on one side of the laundry room, and I had to walk through the laundry room and kitchen and back to the chair and sit down again. The average for somebody with 1 knee replaced was 60 seconds. So she told me to go ahead and try it, which I did, and completed it in 9 seconds. And,
wow.
Yeah, she said she wasn't going to turn my score in, or nobody would believe it anyway. But it's just been totally amazing, everybody I've talked to so far on these knees. In fact, I've already set up a tea time for the 7th. So
wow.
I think I've got everything in pretty good order. But I did have one question on this. I'm not allergic to anything, praise the Lord on that. But the pain pill I was taking during all this was tramadol, because it's really easy on my system, and it seems to work better than anything. And but during surgery, they gave me some oxycodone.
Yeah.
And I tripped for, I think, 4 days after. So whatever they're going to give you, if you haven't had it before, or even if you have, just make sure it's going to act completely different. Not completely different, but it's going to act a lot different than what you're used to.
Right.
So that really scared me. But anyway, your product is fantastic.
Thank you.
And I thank you much for it.
Well, thank you. That was a great story. I mean, 9 seconds. I'm not sure I could do it in 9 seconds. I haven't had surgery, so.
Well, if you want to play golf as bad as I do, you would.
I suppose. And that's a good point about the drug medication. I mean, I know that sometimes people need it, and they give it to you, especially they don't want you to be in pain, but it does pack a wallop, and you have to take it with great care.
Yes, you do.
Tim, this is Paul again. Thank you for sharing that. You were doing it so fast, I thought they might have you put a load of laundry in the laundry room. But,
that's next week.
Let me. You said that they were kind of amazed. Have they said anything like, "How is this possible? What are you doing?"
Yeah, I've got 3 people I really owe a explanation for. Clay just got me some brochures down here and some information I can leave with them. This is 2 therapists and 1 doctor that I got to be friends with. They just the entire healing process I've gone through has just been unheard of. Everybody's been, just in shock. They haven't known what to say, and I didn't know what to tell them either. So I've been doing more and more research and all this. So I'm going back to talk to them again and give them the brochures and let them do their own homework. I think all they have to do is see the little video you have on the blood. That is the most amazing thing I've seen.
How old are you, Tim?
I'm, let's see, I was I'm 70 years old.
Wow.
I normally don't count the years I was sick, but no, I'm 70.
I don't blame you. But you said that the brochures are important, or the videos and all that, but still the proof is in the pudding, and with all the videos and the brochures and the science and everything else, without you having had that type of recovery, nobody would believe it anyway. So that's the important thing, because it's got to work in the real world. So
they've all seen the pudding. Now they want to see the proof. I guess you would call it that way.
To be your golf score.
But, needless to say, they've never heard of Prodovite.
Not too many.
No, they wouldn't. But
too many people have. Yeah. No,
But I showed it to one doctor, and I didn't have anything for him, so I just cut your entire label off and cleaned that out as much as I could. And he was just really excited and quite shocked at all the ingredients you had in there. In fact, the only question he had was, you have so many ingredients in there, could they all work together? And I told him that, well, obviously they are, because we just have too many testimonies that are, are all behind the product. So now it's just a matter of getting them to start ordering some.
Well, that's great. Well, thank you for sharing that.
Well, thanks for getting me involved on it, Clay. And God bless you all.
Did we have a question? Was that Gina? Did you have a question for Tim?
Yeah, I just wanted to say I talked to to Tim several times before his surgery, and my goodness, to hear him now and how great he sounds, compared to how he was before the surgery. Because Tim, I think, Tim, if I'm not mistaken, your surgery was canceled once, or the doctor was sick or something, but it was pushed back, and he was literally in severe pain, could barely walk, had to stay in the bed a lot, had to take pain pills. So I know it was a very much needed surgery. And I also want to thank both Tim and Clay, because they both are veterans and have served our country. And one thing they do to give back, as well as Prodovite, is Tim and Clay make these awesome canes, and they give them to disabled vets, and they do it for free. And they have a website called canesforheroes.com, and we're going to add up their testimonials to the site so they can share Prodovite with these heroes as well.
Super.
Wow, thank you very much, Gina, and thank you to Tim and Clay for making that effort to make this world a better place. I really thank you for that.